Well, this is my video. It's going to be on blister care. I spent 20 years in the military and a lot of backcountry hunting, a lot of other things but most of my military experience for treating blisters. And I felt like a lot of things on YouTube, they really don't cover it very well. And being a paramedic, I thought it might be a good idea for me to just give some, instructions on how you actually should use it and how you can treat your blisters, like using moleskin or whether you use leukotape, some of the other things you can do. Mostly the first thing I like to say is that if you're having blisters, chances are either your boot isn't fitting properly or they're brand new boots and you haven't broken them in yet, which you really need to do. You need to spend the time and break your boots in properly. The other thing could be, which I'll show later in the video, is you might not be securing your heel or securing your boot properly. Sometimes there's a lot of heel slip in a boot, which can cause avulsion to the back of the ankle, or it can cause the foot to slip in the front and cause blisters. So I'm going to do a demonstration using my daughter here, and I'm going to explain basically what I do in my kit. And this is a small kit that I basically put together. I'm a moleskin fanatic. I've used it in the military for many years, and a lot of people, they prefer the leukotape, which I have leukotape, and I'll explain that to you shortly. But I'm a moleskin guy. It has a felt feel on this side, which keeps it in the boot, keeps it to hold up better, and keeps from wearing against your skin. What I like to do is I throw a whole little packet together that you can actually put in your cargo pocket with a small safety clip, which you'll use to, if you have blisters that are, have bubbled up, you're going to want to drain the fluid out of them, and I'll show how to do that and explain that shortly. In the kit, I have alcohol wipes. I have the towelette wipes right here. I keep in the kit also, and I'll show how all this is used here in a minute. I keep either 1x1 gauze in the self-sealed packages, or 2x2s, or if you want, you can actually pack yourself up some 4x4 gauze yourself, put them in there. They're not sterile, but for what you're doing with your feet, it's not necessary. Okay, so moving along, before I don't get off on a tangent, the first thing I want to do is on my daughter's feet here, you can see that I've simulated a blister to the side of the foot, and I've simulated an avulsion to the back of the foot. The first thing you want to assess is, let's say this one here is actually a blister that's sticking up, and you want to, it's bubbled up, so it's going to hit in your boot. What I do is I use a safety pin like this, and now you can use a lighter, like I have here, a Bic lighter to heat it up, the end of it here, or you can use, what I like to use also is the Benadine wipes, iodine wipes. Very good stuff to have, and I'll explain that to you here in a second, but it actually will sterilize this. You can use alcohol pads. I carry both in here, alcohol and the iodine pads, and I'll explain to you why I use it. Having one of these is also a good idea. A little survival tip on that. You see I put 550 cord, a piece of 550 cord on it. In the 550 cord, there's these white strands. There's usually 5 to 7 of them. If you pull them out any length you need, you can actually turn this into a fishing lure. Fish bites on it, catches on it. It actually works in a survival situation. You can actually bush this end up here and make it almost look like a fly that you would use for fishing. That's a whole other ballgame. I want to share that with you. These are good to have. So what you do is, if you have the blister here, the first thing you're going to want to do is clean it off with a moist towelette. Clean the whole area first. I'm not going to go through all that, but basically clean the area off with a moist towelette. And then what I like to do at that point is I'll take a Benadine wipe or iodine wipe, and I'll take and wipe the foot with that. Now, when you think about these, this is pretty hard stuff there. When you think about these, you're thinking, well, I don't want to get it all over the place. But actually, it's a good idea too, because what this does, as you can see, it's an antiseptic. So you basically wipe the whole area down, in the center, all across. My daughter, I don't want to get her foot all stuck with this, but you can see a Benadine wipe. It's going to kill everything on there. It's going to treat it, keep bacteria from forming. And there's a side benefit to that, and I hope I'm not rambling here. It'll help the moleskin actually stick to your skin, or if you're using leukotape, which has got a zinc oxide base adhesive, will actually stick to that better. So now there's different kinds of moleskin you can get. You can get these pre-made sheets, which come from Adventure Medical, and they come with little pre-cutouts like this. And so let's simulate on that one. We're using those, and you pull these off like so, and then these will go right over the top of that. So you put it over the top of the blister like so. Now, you've drained the blister from the bottom. You've leave that on there. You've treated all that. You've put the Benadine on it. If you had alcohol, you could swab the area first with alcohol, after using the towelette wipe. You don't necessarily need to, or you could use just alcohol. It's your option. This is just a suggestion. You don't have to use all of them. If you use the Benadine, it's going to treat better than the alcohol. It's going to cover everything, and it's going to help this adhere. So the other thing you can do is, if you have these sheets, which I prefer the sheets yourself, or we used to get in rolls in the military, you cut it yourself to fit whatever you want. Now, if you see on my daughter's ankle here, I put what's called a big avulsion. That would be from the heel being loose right here. So in that case, you're like, well, how am I gonna, cover that? Should I leave an opening for it? Well, not in that case, you're not going to. What I suggest you do is what's called an island bandage. Now, I could use the 1x1 bandage, but just for simplicity, I'm gonna go ahead and cut this and show you how we do it. You just take and cut your bandage. You take this wrap piece here, and you could put antibiotic on it, which would be like, I like Neosporin. Now, Neosporin comes in two types. You can get the ointment or you can get the cream. When you're dealing with the feet, this is ointment. I recommend you use the cream. The reason why, ointment has an oil base to it, and the oil base will leak into your moleskin and cause it to come loose. So I prefer using the cream on the feet. Everywhere else on the body, I use the ointment because it absorbs, it seems to absorb a little better. So anyway, you would treat your bandage that you cut. Now this one I cut extremely large, so I'm gonna cut it down. I'm doing this kind of fast, so bear with me. So you take your moleskin, you peel your the back of it back. You're gonna do what's called an island bandage. So you take your moleskin, you place this, you know the size you need, so you place it underneath here in the center. All right, I'm gonna do this over again because my phone battery died. We're gonna make this quick. The last part of the video, you got kind of lost. I'm gonna add this to the part of the video, so it's kind of choppy. Forgive me. A lot of people have that slippage movement in the heel. I'm gonna show you how to lock it in. Take your loop like you normally do and come around twice, like so. Just one more time and pull down tight. It will lock in and hold itself. Do this above this side one that pulls in on your ankle. Then come down, lock into there. Come across again, do the same thing. Around once like your normal, and one more time, lock it in. Now you could literally go up and lock them all in like that if you needed to, if your heel's that much of a slippage problem. But all you need is the one before and the one after, locking it in here and here with a surgeon's knot. You can do them the rest of the way up if you'd like, but you see this holds just like it is. Now, I'm gonna end this video with this and then tell you that if you do this, it'll help your heel from slipping. If you have high heel slippage problem, this will eliminate a lot of your blisters. And I hope this video turned out okay, and I hope that me slicing this together or splicing it together will turn out okay. Thank you.